If your doctor has recommended surgery to treat your diabetic retinopathy, it's important to remember that treatment does not cure retinopathy, but often is effective in preventing further vision loss. Let's discuss some of the important things you should understand about types of surgery to treat diabetic retinopathy. If you have swelling of the macula, the central part of your retina that is responsible for fine vision, it is called macular edema. Your ophthalmologist may recommend that you have a laser treatment called focal laser to reduce the swelling and slow progression of vision loss. An eye drop anesthetic is used for this outpatient procedure. The laser is aimed at specific areas at the back of the eye to reduce the swelling. The goal is to slow progression of vision loss. The risks associated with focal laser treatment include bleeding, blind spots in your vision, abnormal vessel growth, persistent or progressive vision loss, and the need for more laser or surgery. If your ophthalmologist finds significant abnormal blood vessel growth on your retina, he or she may recommend another form of laser treatment called pan-retinal laser photocoagulation, or PRP. An eye drop anesthetic or an injection of anesthetic around the eye is usually used for this outpatient procedure. The laser is targeted at many spots all around the periphery of the retina to try to reverse the abnormal blood vessel growth and stop or prevent bleeding into the back of the eye. If untreated, these abnormal vessels lead to bleeding, scarring, retinal detachment, and loss of vision. Risks and possible side effects associated with PRP include decreased night or peripheral vision, blind spots in your peripheral vision, loss of central vision, retinal bleeding, retinal scar tissue, or persistence of the problem, requiring additional treatment. It's important to note that while you do have a chance of experiencing any one of these undesirable side effects from PRP, and there is some risk involved with the anesthetic injection around the eye, you have a greater chance of developing severe vision loss if you do not treat diabetic retinopathy at all. If your ophthalmologist discovers retinal scarring or detachment, or if you have a hemorrhage in the vitreous that is too large or too slow in clearing, a procedure called a vitrectomy may be recommended. This procedure is usually done in the operating room on an outpatient basis. A local anesthetic injection along with sedation is generally used. With vitrectomy, your ophthalmologist removes the vitreous gel and blood from the back of your eye, removing any scar tissue from the surface of the retina. Laser treatment may be used on the retina to prevent further growth of abnormal blood vessels. Vitrectomy is a surgical procedure and as such carries certain risks associated with the anesthetic used, as well as the procedure itself, like any other surgery. Risks associated with vitrectomy surgery include bleeding, infection, retinal detachment, recurrent or new scar tissue, cataract formation, increased pressure in the eye, persistence or recurrence of the problem, possible loss of vision, possible loss of the eye, or possible need for additional surgery. During surgery, if your ophthalmologist finds a retinal tear or detachment or scar tissue, he or she may need to place a gas bubble in your eye to help the retina heal properly in place. If so, you will have to keep your head in a certain position for anywhere from a few days to a few weeks, depending on the type of gas used. You also can't fly in an airplane or go to high altitudes while the bubble is in your eye. In some cases, silicone oil may be used instead of a gas bubble, and this requires additional surgery for removal. Although it's impossible for your doctor to inform you of every potential complication that may occur with eye surgery for diabetic retinopathy, he or she will aim to answer all your questions to your satisfaction. Also, it's important to remember that all of these procedures for diabetic retinopathy are preventative. That is, the goal is to try to maintain as much of your vision as possible for as long as possible. These procedures don't usually give you back any vision you may have lost, although sometimes removing blood or scar tissue can improve vision. If you have diabetes, it's important to remember that you can significantly lower your risk of vision loss by maintaining strict control of your blood sugar and other medical conditions. You must also know, however, that diabetic retinopathy can still occur even if your blood sugar is controlled, so regular visits with your ophthalmologist are crucial for monitoring changes that could impair your vision.